All right, let's jump right in. We're going to talk about something that affects millions and millions of people: anemia. But let's not think of it as just some number on a lab report. No, let's frame it as what it really is: a critical breakdown in your body's most essential delivery service, the one that carries oxygen to every single cell you have. You know that feeling? That deep, bone-weary fatigue that no amount of coffee seems to fix? Where you're just totally drained, even if you got a full night's sleep? Well, that's one of the biggest red flags that your body's oxygen delivery network might be in trouble. So what is anemia really? At its core, it's a shortage of hemoglobin. Now, think of hemoglobin as the special little seats on your red blood cells where oxygen buckles in for the ride through your bloodstream. So fewer seats means fewer oxygen molecules get delivered to your muscles, your brain, all your vital organs. It's basically a logistical crisis happening on a microscopic scale. To figure out how to fix this, we've got to understand the problem inside and out. We're talking about a full-blown oxygen crisis happening inside the body, and you need exactly the right tools to solve it. And luckily, we have a pretty powerful toolkit. These are called hematinics, basically the stuff that helps build blood. The main players are iron, which is the essential building block, vitamin B12 and folic acid, the super important cofactors, and erythropoietin, which you can think of as the production manager. Let's break down what each one actually does. We're going to start with the number one reason for an oxygen delivery failure: an iron shortage. When it comes to making hemoglobin, iron is the absolute star of the show. Okay, now get this: 3.5 grams. That's it. That's the average amount of iron in your whole body. That's about the weight of a single penny. But that tiny, tiny amount of metal is absolutely vital for moving oxygen around and keeping your energy levels up. Every cell you have depends on it. So how does this iron get to where it needs to be? Well, think of it like a whole supply chain. First, you eat it. Then it gets absorbed in your gut. From there, special protein trucks, called transferrin, pick it up and drive it through your bloodstream. Any iron that's not needed right away gets put into storage warehouses, called ferritin, ready and waiting for the bone marrow to call on it to build new red blood cells. But here's the catch, and it's a big one. Just because you eat iron doesn't mean your body can actually use it. See, absorption is a really tricky business. Things like vitamin C are just an acidic stomach environment. They help your body grab onto it. But on the other hand, things like antacids, milk, or even certain compounds in plants can totally block it, meaning that precious iron just passes right through you. So what do we do to fix a deficiency?
Well, for most people, the first line of defense is just taking oral iron pills. Simple enough. But what about people who have absorption problems, or maybe they've had stomach surgery, or they just can't handle the side effects? Well, for them, we have to bypass the gut completely and send the iron directly into their system with an IV or an injection.
And speaking of those side effects, taking iron by mouth, well, it isn't always a walk in the park. It can be pretty rough on the stomach, causing stuff like nausea, cramps, constipation. You get the idea. And yeah, that dark stool color is super common and usually harmless, but it's one of the main things that makes people stop taking their supplements. Now, this is a critical safety warning. You can't just throw iron at every single type of anemia. In what's called hemolytic anemia, the problem isn't a lack of iron, it's that your red blood cells are being destroyed too fast. Giving someone iron in that situation is actually dangerous because you're just causing an iron overload. Their body is already full of iron from all those recycled, broken down cells. Okay, but it's not all about iron. You can have all the raw materials in the world, but if you don't have a good assembly crew, production just grinds to a halt. And that's where our vitamin power duo comes in: vitamin B12 and folic acid. Vitamin B12 is just a fascinating molecule. Not only is it vital for making red blood cells, it's also absolutely critical for keeping your nerves healthy. And it has this really unique gatekeeper for absorption, a protein made in your stomach called intrinsic factor. If you don't have that, B12 just can't get into your system, which leads to a specific kind of anemia called pernicious anemia. And then there's folic acid. This one is the master of replication. It's essential for making DNA, which is, the blueprint for every single new cell in your body. Our bodies don't store a lot of it, so a deficiency in your diet can show up as anemia in just a matter of months. This is also why it's so incredibly important during pregnancy. It helps prevent devastating neural tube defects. Now, this is where things get really serious. Pay close attention here. While both of these deficiencies can cause anemia, only a B12 deficiency will lead to neurological damage. We're talking symptoms like numbness, tingling, poor balance, and that damage can become permanent if you don't treat it. Folic acid deficiency, it does not cause these nerve problems. This difference is absolutely crucial for what's coming next. And this leads us to a massive medical warning. If a doctor sees this type of anemia and just prescribes folic acid without checking B12 levels first, they could be setting their patient up for disaster. The folic acid might fix the blood test, the numbers look better, but what you're really doing is masking the underlying B12 deficiency. So the anemia looks better on paper, while the patient's nervous system is suffering progressive, irreversible damage in the background. It is a huge diagnostic trap.
So what happens when the problem isn't the raw materials, but the factory itself? Sometimes the bone marrow just isn't getting the memo to make more red blood cells. That's when we have to call in the specialists, the hematopoietic growth factors.
Right. So erythropoietin, or EPO for short, is a hormone that acts just like a factory foreman. It's mostly made by your kidneys, and it travels to your bone marrow with one simple, clear message: make more red blood cells and make them now. For people with kidney disease, EPO production can just plummet, and that leads to severe anemia. A synthetic version of EPO can be an absolute lifesaver. And here's a little fact that shows you just how powerful this stuff is. By boosting red blood cell production, EPO dramatically increases how much oxygen your blood can carry. This gives you a huge boost in stamina and performance, so much so that it's considered a performance-enhancing drug and is totally banned in professional sports. So, we have this amazing toolkit, right? We have iron, we have vitamins, we have growth factors. But the final, and maybe the most important lesson here, is that treatment is always a delicate balance. More is definitely not better. And iron is the perfect example of this. It's essential, yes, but it is also toxic in high doses. Acute iron poisoning, usually from a child accidentally getting into supplements, is a true medical emergency. And long-term, chronic iron overload, a condition called hemochromatosis, can cause severe, lasting damage to organs like your liver and your heart. Okay, let's do a quick recap of our toolkit. First up, iron. Its primary use is for iron deficiency, and the number one thing to remember is to never use it for hemolytic anemia. Next, B12 and folate. They're for specific deficiencies, but you absolutely must rule out a B12 deficiency before you treat with folate alone to prevent that nerve damage. And finally, EPO. That's the growth factor for anemia from things like kidney disease, and its key trait is that it powerfully kicks red blood cell production into high gear. And that really brings us to our final thought. As we've seen, feeling tired could be a simple iron shortage, or it could be a complex vitamin absorption problem, or it could even be kidney failure. Each cause needs a totally different tool from our kit, and using the wrong one isn't just a waste of time, it can be actively harmful. So the real question to leave you with is this: knowing all the risks, is trying to fix your body's oxygen delivery system all on your own really worth it?